Welcome to The Explainer. Today, we're diving into the pretty remarkable comeback of psychedelic medicine. What was once seen as strictly counterculture is now, believe it or not, at the very forefront of mental health research. So let's break down how we got here and what it all means. Okay, picture this. It's a scene you probably never, ever imagined. You've got Donald Trump in the Oval Office. Behind him, podcaster Joe Rogan, and Trump is signing an executive order to speed up research into hallucinogens. He even cracks a joke, asking for a dose of ibogaine, which is this incredibly powerful psychedelic. I mean, this single kind of surreal moment, it really captured headlines, and it signaled that something profound was shifting. And, this wasn't just some strange political theater. That order, it sent psychedelic company stocks soaring. This was a real turning point. These substances are moving out of the underground and into the highest levels of government and, finance. But to really understand this shift, we have to get really clear about what we mean when we say psychedelic medicine. So, to wrap our heads around this massive shift, we've got to get our terms straight. Because we are not talking about taking mushrooms at a concert. No, this is a very specific, very clinical application. The word itself, psychedelic, it gives us a huge clue. It was coined way back in the 50s, and it literally means mind manifesting. And that's the whole goal of this therapy, to reveal what's hidden deep in the mind, to bring those unconscious patterns and traumas up to the surface where finally they can be processed and maybe even healed. This right here really highlights the stark contrast. On one side, you have totally unstructured recreational use, but on the other, you have the therapeutic model. And here, everything is controlled. You're in a clinical setting, you have a precise, medically supervised dose, and you're guided by trained therapists who have one single focus: healing. Two totally different worlds. And it's this rigorous clinical approach that's producing the kind of evidence that's driving this whole new wave of interest. So let's take a look at what researchers are actually studying. So the research is going after some of our most difficult to treat conditions. We're talking about MDMA for severe PTSD. Psilocybin, which is the active compound in magic mushrooms, is being looked at for depression and alcohol use disorder. And even LSD is being reinvestigated for alcoholism, picking up on research that was totally shut down decades ago. The results for MDMA in particular have been absolutely stunning. So much so that the FDA, that's the US Food and Drug Administration, gave it this special breakthrough therapy designation. Now, this is a big deal. That status is reserved for treatments that show a massive improvement over anything that already exists, and it's meant to put them on the fast track. Okay, so this is a crucial point. The treatment isn't just taking a pill. Not at all. It's a whole structured process. It starts with preparation sessions with a therapist, to build trust and set intentions. Then comes the actual dosing session. And finally, and this is arguably the most important part, there are integration sessions to help you make sense of the experience and turn those big insights into lasting change. And this really gets to the core idea here. The psychedelic compound, it's really just a catalyst. The true therapeutic work, the healing, that happens within the structured framework that's built around the entire experience. This quote from the MAPS Code of Ethics, it really gets to the heart of the philosophy. The therapy isn't doing something to you, it's creating the conditions for you to access your own innate ability to heal. It's like the drug opens a door, but you're the one who has to walk through it. And this whole philosophy of supportive care, it extends way beyond the clinic. You've got organizations like the Zendo Project, which focus on harm reduction in non-clinical settings. Their entire model is built on providing a safe, compassionate, non-judgmental space for people who might be having a difficult experience. They recognize that the environment is an absolutely core part of the process. Which brings us to two fundamental concepts in this entire field: set and setting. Set is all about your internal state, your mindset, your intentions going in. Setting is the external environment, where you are, who you're with. Decades of research and countless reports all show that these two factors can radically, fundamentally shape the nature of a psychedelic experience. And like we mentioned, the work doesn't just stop when the drug wears off. Integration is this absolutely essential process of taking the profound, sometimes really confusing insights from the experience and actually weaving them into your daily life. It's where a temporary change has the chance to become a permanent transformation. But for all of this promise, and there is a lot of it, the path to mainstream acceptance is incredibly complex. It's filled with some really intense debate. I mean, just look at this timeline. The Multidisciplinary Association for Psychedelic Studies, or MAPS, was founded way back in 1986 to push for this research. Decades later, in 2024, the first big application for MDMA therapy actually gets rejected by an FDA advisory panel. And just 2 years after that, a presidential order is signed to fast-track the whole thing. It has been a real roller coaster of breakthroughs and setbacks. And as this field just explodes, it's facing some urgent growing pains. There are serious concerns about who's going to profit from all this. There are huge debates about ethical standards and leadership. There are crucial questions about how to properly honor and compensate the indigenous communities who were the original stewards of so many of these plant medicines. And just on a practical level, there's a massive shortage of therapists who even have the training to do this work safely. Amidst all of this complexity, proponents like Rick Doblin, the founder of MAPS, they argue that the focus has to always come back to one thing. As he puts it, it's about what's best for patients. The ultimate goal, he insists, just has to be healing. And that leaves us with this final, really critical question. The science is moving incredibly fast, and the hype is building around what could be a multi-billion-dollar market. As this whole new frontier of mental health treatment opens up, the biggest challenge is going to be navigating all that excitement and all those financial interests to build a system that truly prioritizes patient well-being and healing above everything else.